Okay, one of the perks about doing home health, especially intermittent visits, is the flexibility. You are in charge of your own schedule. There are nurses that take advantage of this. They will make their schedule, and let's just say, I don't know, a concert comes up, maybe they just, who knows, it could be anything, but there's some nurses that make a habit of constantly rescheduling their patients because typically, like I said, about 80% of home health patients are Medicare patients. And one of the stipulations of receiving home health when you're a Medicare patient is that you have to we have to qualify them as homebound. Homebound meaning that one of the reasons why a nurse has to come to your home is because you are not capable of making it to the doctor's office. You're not capable of leaving your home. Meaning that Medicare patients should be home the majority of the time. They give them leeway to go grocery shopping and to go to doctor's appointments. Other than that, if you're homebound, per Medicare requirements, you need to be at home. Some nurses take advantage of this. Just because your patient's homebound and home 90% of the time doesn't mean you can just pop up whenever you feel like it, you know? Give them some common courtesy. So this brings me back to what I was talking about to begin with. It happens. You need to reschedule. Don't. Some nurses will just call the patient and say, "Hey, I can't see you today. I'm going to see you tomorrow." Or they'll call. It's very common to. Okay, let me rewind. So sometimes I get patients, I'll get a new patient, and for some reason I didn't check the map and I didn't realize that they're in an area that I'm about to be in tomorrow. Or they're right around the corner from a patient, that I'm about to see the very next day. And I don't want to go to this area 2 times in a day. Some nurses will just cancel a visit or reschedule. I try not to do that. What I will do, because you got to make the patient feel like they're in control. If you just call and reschedule, they will call the office and be like, "Give me a new nurse." So the patient that I am planning on seeing the next day, that just so happens to live around the corner from a patient that I'm seeing today, I will call them and say, "Hey, Miss Such and Such, I know we had an appointment scheduled for tomorrow, but I just wanted to let you know I had some cancellations, and I am available to see you today." 90% of the time they're like, "Oh, okay, that's fine, honey, come on." That sounds so much better than, "I've got to come see you today. I'm not going to be seeing you tomorrow." After you already done set up this appointment with them. So keep that in mind. Sometimes it's not what you say, it's not what you do, it's how you do it. So if you've got to have a change in your schedule, patients, like I said, most of the time they are home all the time and they will accommodate some scheduling changes. Just approach them the right way and make them feel like they have a say in the matter.